And hello, everyone. I'm Dr. Brian Sims. I'm Senior Medical Advisor with the National Association of State Mental Health Program Directors, and I am thrilled to be your host today for the 186th episode of the 988 Crisis Jam. And I'm so pleased to be able to be the host for today's particular jam because we're going to be talking about 988 LGBTQ plus youth specialized services. And we are honored to have Sarav Jung Thapa as our speaker for this today's session. And we're looking forward to really receiving the much needed information and resources that we can see will be very helpful as we move along. So let's go to the next slide, please. To go to talk.crisisnow.com is just a reminder that this is a rich resource site that you can go to. But before we even go into the contents, I did want to also mention that because of extension issues with Zoom, some of you may be receiving a message that is telling you that you have to extend your services. After 1 year of being on Zoom, they require an extension. So in that process, if you go to the chat box, you'll be able to see instructions about how to continue it on your calendar and even instructions on how to add it if you didn't previously add it to your calendar. But on this site, you can also see a lot of information. You can get past videos of the crisis jams that have previously taken place. You can see on the screen one from last week that was just absolutely phenomenal. So it is a rich resource site to utilize. Next slide, please. Now, in terms of looking at some of the news, the Mid-City News had an article that was placed about America's loneliness epidemic that is fueling a mental health crisis. And it really goes into a lot of detail with regards to how COVID really set this place in motion. And we can all imagine that COVID isolated so many people, and the number of mental health crises that occurred just out of the isolation makes this an important article to read. So when you have an opportunity, why don't you reference this particular article? Next one, please. SAMHSA, who's busy at work at all times, has sent out a release of an updated language access plan. And this is a phenomenal move on the part of SAMHSA because what it is doing is really opening the doors to those of other languages to give them links to the multiple resources. We've seen SAMHSA through their SAMHSA store and otherwise provide tons of information with regards to 988 and all the information that could be used to get the message out to the public. And this is a wonderful access plan that now allows those with different languages to come on board, receive the data that they need, get the resources that they need. So a very valuable piece there. And next slide, please. This is one of the resource slides, but it's also a reminder that 988 Day is coming up on September 8th. Get it? And this is really a public slide that could be utilized. So it's one of the resource materials that you could actually take out and post up if you'd like to place it in certain areas. But it's to get the word out that we're really trying to raise awareness in all communities and amongst all people, that 988 is viable, that 988 is actually in place, and that it is helping people. So with this, you can take a look at this particular slide, but there's also a number of other resources that will be in support of the same event. Next slide, please. Now, under the National Archives, I'm going to also point out this particular section that talks about Medicare and Medicaid programs and opens the door to a lot of information about opioid issues and billing components. And this is something that a lot of people have had a lot of questions about. So it's a great reference point to go to. And it was a proposal that is being put out. And I think it was maybe the latter part of last month when the proposal went out. But it can give some additional information for those seeking responses about the savings program requirements and the opioid program components as to how the Federal Register is handling it. All righty, next slide, please. And we have come to the crisis hot seat. Now, today we don't have a person for our crisis hot seat. So the audience, you guys are all back on there. You've got some great records going for you. So I'm really counting on you to come through on this particular one. Now, as we've been talking about, the issues today are going to be around the LGBTQ plus community and the resources available to them. So just to start off as an overview, the LGBTQ plus individuals are more likely to experience mental health issues compared to heterosexual and cisgender peers. Now, the LGBTQ plus youth are particularly vulnerable to mental health challenges. So your question, audience, what percentage of LGBTQ plus youth report experiencing symptoms of anxiety or depression as compared to the non-LGBTQ peers? So you've got your choices: A, 20%, B, 35%, C, 50%, or D, 75%. So as it pops up on your screen, I invite you all to do so. If you don't have a screen or otherwise, please feel free to put your answers into the chat box. Love to see that. And again, we want to encourage you, keep open conversations going through the chat box if you have questions or otherwise. And we'll give it just a bit. All righty. So what we have here is the polling from the audience indicates that a majority of you, roughly over 60% of you, are saying that it is 75%, with just maybe a third coming in at 50. And the answer, folks, is indeed, it is 75%. And the studies are showing that they're significantly more likely to experience anxiety and depression compared to their non-peers, with about 75% again reporting this. Now, before we get into introducing the speaker for today, we're going to be talking about the Trevor Project. And I'm sure most of you are familiar with the Trevor Project, but the Trevor Project is one of the leading suicide prevention and crisis intervention nonprofit organizations for LGBTQ plus young people. They provide information and support to the LGBTQ plus young people 24/7 and all year round. And in one of their PSAs, before I introduce the speaker today, I just wanted to show you very quickly this particular PSA announcement that is spearheaded through the efforts of Daniel Radcliffe. So go ahead, please. And again, I can think of no better way to move into our discussion this morning than to show that particular preview. So it is my honor, folks, to introduce to you Sarav Jung Thapa, who is the Senior Federal Affairs Manager at the Trevor Project. And he has over a decade of experience in policy advocacy, communications, project management, and writing and editing on LGBTQ plus issues and public health. He is in his current role, he's worked as an advocacy and government affairs team federal work on 988 suicide prevention, advocacy, and other issues. He also leads the Trevor's engagement on U.S. foreign policies issues. So prior to joining the advocacy team, Sarav served as the international strategy team where he led planning for the launch of Trevor in Mexico. Now, before Trevor, he worked as a global research and communications lead at the Human Rights Campaign and was a technical officer at the United Nations in Asia. So without further ado, it is my honor to present Sarav Thapa. Please go ahead, sir.
Thank you, Dr. Sims. Thank you, everyone, for being here. Excuse me. Really appreciate the 988 Crisis Jam organizers having me here and giving this opportunity to the Trevor Project to present about our work on 988. And I'll just start by saying that, that video with Daniel Radcliffe is just so powerful. I'm personally a huge fan of his. I grew up in Nepal in the 1990s reading Harry Potter, and I've watched every single movie, read every single book, watched every single movie. So to have Daniel Radcliffe in our corner is just incredibly powerful. So with that, could I get the second slide, please? So I'll just do a quick introduction. I know Dr. Sims just introduced me, so I won't get much into that, but let me just tell you a little bit more about what Trevor's advocacy team does. So, first and foremost, we advocate for the 988 Suicide and Crisis Lifeline and for the LGBTQ youth specialized services within it. That is a major part of my portfolio. That is a top priority for the Trevor Project. We also combat the discredited and harmful practice of so-called conversion therapy, knowing that it harms LGBTQ young people. We also fight to pass supportive laws and policies that benefit LGBTQ plus youth. And we oppose harmful laws and policies that put LGBTQ plus young people at risk. These include the 500 or more anti-LGBTQ and especially anti-trans state laws that have been proposed in the last year throughout the country. These laws have been incredibly harmful. They've forced a lot of families with young trans people to move to more welcoming states. They've displaced families. They've caused a lot of harm. So we oppose those laws and work to fight them. So next slide, please. So I just want to tell you a little bit about the Trevor Project, like who we are and what we do. As you can see on the slide, we are the leading suicide prevention and crisis intervention organization for LGBTQ plus youth in the United States and now also in Mexico. Our phone, text, and chat crisis services provide free 24/7 confidential life-saving services and life-affirming support and crisis counseling to LGBTQ plus young people. We work with young people ages 13 to 24. We do this through two main ways. The first one is through our Trevor Classic services that have been continuously operational for 26 years now. And since September 2022, for the last 2 years, we've also been part of the 988 Lifeline. Our suicide prevention programs include advocacy, research, public education, and an online platform called Trevor Space. Through these programs, we seek to ensure that LGBTQ plus young people never enter a crisis in the first place. And I will also take this opportunity to do a little shout out for our new CEO. Please allow me to make a plug for them. Our new CEO's name is James Black. They go by they, she, he pronouns, and James started with us last month in July. James previously served as the Executive Director of Family Equality and worked in the corporate sector for 20 years. For folks, especially those of you who are in the DC region, I hope you have a chance to meet James soon because they live in the DC area. Next slide, please. So now I'd like to talk a little bit more about why the Trevor Project works to prevent suicide and provide crisis intervention services to LGBTQ plus youth. Why do we do the work we do? Our most recent sixth annual U.S. National Survey on the mental health of LGBTQ young people, which came out earlier this summer and reached 18,000 young LGBTQ people ages 13 to 24, found some pretty sobering statistics. For example, 39% of LGBTQ youth seriously considered attempting suicide, including 46% of trans and non-binary youth. Half of LGBTQ plus youth who wanted mental health care were not able to get it. 90% of them said their well-being was adversely impacted due to recent political developments, such as the anti-trans laws that I talked about earlier. And finally, 49% of LGBTQ plus youth ages 13 to 17 experienced bullying in the past year. And those who were bullied reported significantly higher rates of attempting suicide. So again, there's, LGBTQ plus young people face a mental health crisis and elevated suicide risk. And to a point that was raised in the chat earlier, these risks arise from societal mistreatment and stigma, and not because of the sexual orientation or gender identity of young people. So I do want to thank the colleague, I think from SAMHSA, who made that point earlier on the chat. Really appreciate that. And also going back to some federal government data, earlier this month, the CDC released its Youth Risk Behavior Survey data, summary and trends report from 2013 to 2023. And according to a press release from AFSP, nearly all measures of poor mental health and suicidal thoughts and behaviors have worsened from 2013 to 2023. Things are getting worse for young people. This includes a rise in the percentage of young people reporting persistent feelings of sadness or hopelessness, those seriously considering suicide, planning suicide, and attempting suicide. The YRBS data from CDC and AFSP's press release also noted that there are continuing disparities. For example, in 2023, LGBTQ youth were more likely to experience persistent feelings of sadness or hopelessness, poor mental health, and suicidal thoughts and behaviors. Next slide, please. So let me talk a little bit more about the 988 Lifeline and the Trevor Project, why 988 is so central to preventing suicide and providing mental health services to LGBTQ plus youth. Creating the 988 Lifeline, as you all know, took over 4 years of organizing by mental health groups, 3 federal laws, and bipartisan collaboration on the Hill and with the FCC. Many of you here represent organizations, including leaders in the field such as AFSP and NAMI, that played a leading role in working to create 988. Trevor was proud to have been part of the coalition effort to create the 3-digit 988 Lifeline. We got involved in 988 advocacy to make crisis services more accessible for all people, including for LGBTQ plus young people who are at higher risk of suicide and face disproportionate mental health challenges. Trevor wanted to contribute to a system by which young LGBTQ people could be routed directly through 988 to culturally competent providers like the Trevor Project and other organizations. In 2019, Trevor joined a coalition of mental health and LGBTQ plus organizations that pushed for LGBTQ youth specialized services. The partnership between mental health and LGBTQ coalition partners was critical. Over 100 organizations signed a formal comment calling for 988 and for LGBTQ youth specialized services. Trevor, also supported specialized services for veterans, and veterans organizations in turn supported LGBTQ youth specialized services. This mutual support across coalitions was key to securing both specialized services, and for that, we are grateful to our partners in the Veterans Crisis Line. And in 2020, Trevor again teamed up with mental health and LGBTQ coalition partners to call on Congress to create 988 pilot specialized services with LGBTQ young people as the test case. The bipartisan bill that was subsequently passed, creating 988, called for SAMHSA to implement specialized services, starting with a pilot for LGBTQ young people. This passed the House, then it passed the Senate unanimously. And when this bill passed the Senate unanimously, this was the first time ever in the history of the United States that an LGBTQ inclusive bill had received unanimous support in a chamber of the US Congress. So that was a big deal. So next slide, please. In September 2022, so a few months after the launch of 988, SAMHSA and Vibrant Emotional Health launched the pilot phase of 988 LGBTQ youth specialized services. The Trevor Project was selected to be the sole provider for the pilot phase, and we collaborated closely with Vibrant to launch the pilot. We started by taking calls and texts 24/7, and this pilot phase, which lasted for 10 months, it was important because it provided us with an opportunity to work out the kinks in the system before the planned transition 10 months later to a multi-center subnetwork, which happened last July, in July 2023. The contact volume for 988 LGBTQ specialized services has been much higher than anticipated, and I will talk about that in my next slide shortly. To keep up with high volume, congressionally appropriated funding has risen each year. We are grateful to Trevor and elsewhere with the subnetwork. We are grateful to the bipartisan coalition of lawmakers who have recognized the importance of specialized services and supported increased funding year on year. So just to give you an example, I mean, the funding for the first year of specialized services was for $7.2 million. That subsequently rose to $29.7 million in FY23 and $33.1 million in FY24. So one point that I do want to make and really emphasize today is that at the Trevor Project, we are incredibly proud of our partnership with SAMHSA, with Vibrant Emotional Health, and the LGBTQ subnetwork, because this is really important work that we're all doing together. And it's great that LGBTQ young people have this resource, 988 specialized LGBT youth specialized services when they need it. So again, as Dr. Sims said earlier, that September 8th is the first ever 988 day. And as part of our partnership with SAMHSA, at Trevor, we are planning to elevate content from SAMHSA on that day. September, the end of September is also the second anniversary of LGBTQ Youth Specialized Services, and we will be doing a blog post and sharing it with our partners. Next slide, please. So this brings me to my final section on the key challenges, the two main challenges that I'll cover today, facing the 988 LGBTQ youth subnetwork. Since the launch of services in September 2022, contact volume has been consistently higher than that was anticipated. The initial forecast was for about 10,000 calls, texts, and chats per month. The actual contact volume was about 23,000 contacts a month. So just to give you a scale of how many people that the Trevor and the subnetwork are serving, in 2023, which was the first full year of services for LGBTQ youth specialized services, Trevor served over 278,000 contacts. In 2024, we've been serving an average of 35,000 calls and 16,000 digital contacts, that's text and chat, for a total of about 50,000 contacts per month. A significant share of the over 10 million contacts with 988 since launch a little over 2 years ago has been with LGBTQ youth specialized services. So for example, this ranged from 8.5% of all calls to 9.5% of all chats and 13.3% of all texts. So just for comparison purposes, the LGBTQ youth subnetwork is serving approximately 10% of all 988 contact volume, while receiving slightly less than 6.5% of overall 988 funding. So that's $33.1 million out of the $520 million allocated to 988 in FY24. So the 988 LGBTQ Youth Specialized Services, like any new program, we've had our growing pains due to the anticipated volume being much higher than actual volume. The limited hours for text and chat needed to be expanded by increasing capacity through the subnetwork. Younger people are also more likely to use text messaging or chats to connect with 988, which is why we need more support for those parts of 988. According to a poll conducted by NAMI and Ipsos in June, only 23% of respondents nationwide were familiar with 988. The same survey from NAMI found that LGBTQ Americans are more likely than their counterparts to say someone in a mental health or suicide crisis should receive a mental health response. So the figures are 93% for LGBTQ people compared to 83% for the general population. Given this data point and the major push underway this year by SAMHSA, HHS, the administration, and mental health organizations to increase awareness about 988, contact volumes are bound to keep rising. This will require additional counselors and additional infrastructure to handle the higher volume of contacts. Next slide, please. So in terms of counselor well-being as a challenge, Trevor's data shows that our 988 counselors face an unacceptably and disturbingly high volume of prank calls, aggression, vulgarity, hate speech, and sexual gratification calls. The volume of malevolent contacts was higher than on our classic Trevor line, the one that's been operating for 26 years. And we can likely attribute this to the higher nationwide visibility of 988. In just a 10-month period in 2023, there were over 16,000 cases of misuse in Trevor's 988 line. The percentage of misuse cases compared to the total contacts on a month-by-month basis ranged between 11% and 14%. So given this challenge and to help our 988 counselors manage problematic contacts, at Trevor, we prioritize several kinds of support that includes training for resilience, defined protocols and tools for navigating misuse and traumatic content, debrief opportunities between counselors, providing space to maintain wellness and be in community with peers, clinical support in group settings, therapy support for staff, and standard EAP benefits and other support options. We know that the work that Trevor's 988 counselors, like the 988 counselors for the entire network, and especially for the LGBTQ youth subnetworks, the work they do is needed and difficult. Many of our counselors have a personal connection or passion to support LGBTQ youth because of their own identities and lived experiences. With this deep connection to the mission of helping LGBTQ youth and the support we're able to provide them, our counselors are able to find longevity in this work, build expertise, and really impact young people in ever greater ways. So for Trevor, continuing and expanding counselor support options will be our highest priority moving into the future. So with that, this brings me to the end of my presentation. I'm happy to take any questions now during the roundtable or later over my email, which is listed on the last slide over there. And Dr. Sims, I'll hand it back over to you.
Well, Sarav, let me just say this. Thank you so much. Thank you so much. For that brief period of time, you put in a tremendous amount of information. I think resource-wise, it drove individuals to place things into the chat box that are particularly helpful and useful. I want to thank Dr. Grubb. She has placed in the chat box not only the information about the YRBS data summary, but also a toolkit for 988 day. So it's nice resources for those who are interested. Please refer to the chat box about that. What you'll also find in the chat is what we discussed earlier. There's a link to the video that we showed with Daniel Radcliffe, but as well in that talk.crisisnow.com. Usually by tomorrow or otherwise, we'll have the slides available as well for those that wish to see them. But again, Sarav, thank you so much for this presentation. I'm going to actually move over to our roundtable discussion at this point. And in our roundtable today, we have two individuals upstanding. First is Laurel Stein, who's the Executive Vice President and Chief Policy Officer for the American Foundation for Suicide Prevention. So Laurel, pleased to have you here on the Crisis Jam, and your comments, please.
Great. Thank you so much, Dr. Sims. Thank you for having myself, AFSP, represented here on the Crisis Jam. And thank you wholeheartedly to Sarav. Your presentation was fantastic, very thorough, and just a really time-sensitive and urgent issue that I hope that everyone on this Crisis Jam takes to heart. AFSP, as you may not know, is the leading national organization dedicated to suicide prevention, and bringing hope to those impacted by suicide. And we're also the private funder of suicide prevention research. As we all know, suicide is a leading cause of death. But as Sarav was saying, most notably, and thank you for the shout out for our press release, the most recent CDC, the YRBS data, is very alarming that 3 in 5 LGBTQ individuals are experiencing persistent feelings of sadness. This all speaks to the critical need for us to continue to promote the mental health, the well-being, and suicide prevention efforts of the LGBTQ youth and young adults, as well as to really explore the health disparities. And I saw in the chat someone had mentioned, I think it was Kara, had mentioned about the stigma, the bias, the discrimination, all that is pervasive and is leading to this. As we know that research has shown that stigma, bias, discrimination with minority sexual orientation contributes to higher rates of suicidal thoughts, behaviors, etc. So I am pleased to be here with NAMI. I know Hannah is going to be talking next, but some of the challenges that Sarav has discussed leads us to really think about what we can continue to do to really support the especially LGBTQ plus specialized services subnetwork. And I think of it as in 3 different buckets, really, like recruitment, retention, and safety. And Sarav so nicely on his slide talked about the high volume of contacts. And so we want to make sure in an advocacy and policy arena that we are well supporting and funding additional and sufficient number of crisis callers. We want to make sure that their well-being, based on the high misuse of the line, that their well-being is protected. And as you know, we are all amplifying on 988 Day of Action that no judgment, just help, but also no harm. And so we want to make sure that across all the centers, there is this basic level of competency on LGBTQ affirming skills for crisis calls. And so those are my three buckets: retention, recruitment, and safety. The statistics speak for itself that this is an urgent need. AFSP is pleased to work in coalition with NAMI, with Trevor, and many others to make sure that 988 is a well-resourced and efficient and effective system from the call centers through the communities. Sarav's presentation really speaks to these three areas that we all can have a role in ensuring that the federal government, Congress, is really paying attention to LGBTQ youth, young adults, the specialized, the subnetwork, in ensuring that we have enough callers, that their well-being is taken care of, and that we also are making sure that the overflow that goes to the backup centers, because of this whole volume, they also have a basic level of competency.
Laurel, thank you so much. I'm just sitting here and I'm finding myself just jotting down 400 notes. So my apologies, I didn't come in like I should, but thank you so much for that. We're now going to move to Hannibal Oslowski, who is the Chief Advocacy Officer with NAMI. And Hannah, great to see you again. And please, your comments.
Good to see you, Dr. Sims. Thank you so much. And it's always a hard act to follow Laurel, and it's especially hard to follow Sarav. That presentation was wonderful. I often get a chance to talk about 988 with NAMI audiences and with others. And there have been so many incredible developments in 988 over the 2 years since it launched. But one of the ones I'm always most excited to talk about is the 988 specialized services for LGBTQ plus youth and young adults. And I recently had a chance to talk to our NAMI Next Gen. It's a group of young leaders who work with NAMI for a year and help advise on the work that we do to reach a youth and young adult audience, and was shocked that some of them hadn't heard about this specialized service. And they were so excited to tell everyone they knew that this existed. It is so important, and especially in the environment that we are now, where people are not allowed to live their authentic lives and everywhere at the moment. It is so important that this lifeline be available to anyone who needs that support. And I think the demand speaks for itself. What's even more important is that there's no wrong door, that anyone contacts 988, if they don't press that button, we also need to make sure every one of our crisis counselors has training and being affirming for LGBTQ plus help seekers. So, I'm deeply indebted to Trevor Project, to Vibrant, and SAMHSA for the work that they've done on this. And I think it is an incredible model for how we help other at-risk communities that we know the support is vital for. It's been great to see the funding increase, but I will say I think we need more. And I think just looking at the amount that is invested in these specialized services compared to the overall amount, there's a lot of demand that's being funneled here. And we need to make sure we have more resources for 988 at large, as well as for the LGBTQ plus youth and young adult line. But I'm so grateful to Sarav for that amazing presentation. And I'm just so grateful that people are calling and reaching out and texting and utilizing that line. I know it's been a heavy burden that their demand has been so high, but again, that speaks to the urgency of continuing to staff up and grow this resource. And it has worked so exceptionally well in the time that it's been available, and to 2 years. I can't believe we're coming up on 2 years of the LGBTQ plus line being available. But there's still so much work to be done to make sure people do know that this is a resource for them, that they can reach out, and that if they identify as an LGBTQ plus youth or young adult, that this resource is something that they can rely on when and if they need it. As I was talking with our NAMI young leaders, they reiterated the need to connect with somebody who has those shared life experiences with them, that has that training, that has that compassionate ear, and that they feel they have that connection to. And there's been incredible work, and I know, Washington State has a line for American Indian and Indigenous services as well. And I think all of these resources are really helping so many people who need that support, but need to be able to talk to somebody who has that shared experience with them. So I don't have much to add to what Laurel said, but just to say thank you, and really excited to see this progress, to see this growth, and to know that for our young people who need this support and help, that this resource is available to them.
Well, thank you again, Hannah, and thank you, Laurel. And if you would, if you guys could just kind of hang around just a little bit. We've had some interesting things dropped in the chat box, and Sarav as well. Just wanted to kind of throw one out, and I'm going to put him on the spot. But I saw a question, or not a question, but a comment from Vic Armstrong. So Vic, if you wouldn't mind, could you pop in and kind of pose that out, or just clarify that with us?
Hey, Brian, sure. Yeah, my statement was, we often rely on the youth risk behavior survey data. And my point was that data captures students who are in high school, but it doesn't capture those kids who may be dropouts or who, for other reasons, are not enrolled. And there may be kids that are even at higher risk because there may be circumstances as to why they're not enrolled in school. So we just need to keep that in mind. And I think there's also an opportunity for us to think of unique ways to reach those kids who are not in a school setting. Things like I spoke with a group from Oklahoma recently that was working on a curriculum for coaches and thinking about coaches as anyone who touches kids. They could be AAU basketball coaches, they could be football coaches, they could be chess coaches, they could be drill team coaches. And so thinking about those kids who are not enrolled in school and how we can reach them through youth centers or other venues in the community, including things like faith-based organizations and other groups like that.
Sarav, any comments, sir?
Yeah, no, thank you. Vic, that's an absolutely great point. And that is with the CDC data, with the YRBS data, yes, they are only looking at students in schools, and it is a limitation. And as Dr. Grubb pointed out with Trevor's methodology, we actually don't just limit our outreach to young people just to schools. We reach out to all LGBTQ young people in the country. Actually, it's a much larger sample size, reaching out to anyone in the country in a certain age group that identifies as LGBTQ, and then whatever percentage response, that's what we base our data on. So it goes well beyond people who are only enrolled in schools or universities. So our data set is wider. So I think we avoid the issue with the CDC data of only reaching out to schools.
Mm-hmm. Well, thank you again, Vic, and thanks for the question. Always good to see you, sir. So I probably have 40 more questions, but I'm going to just move on. Let me just thank Laurel, thank Hannah, just for your spectacular presentation, and for all the support and resources. And a reminder to everyone again that a lot of rich resources have been placed in the chat box. Please refer to the chat box to connect up with those. And as well, when the Crisis Jam copy comes out tomorrow or so, refer to it, let others know about it so you can really get that rich information. So thank you again, Sarav. Thank you, Hannah. Thank you, Laurel. And we are ready to move on to our next area. Ordinarily, this segment would be SAMHSA, and SAMHSA would be coming to us today to give us some form of update. But what you are seeing is a ton of smiling faces, because right now we have no representatives from SAMHSA because they're all at the National Guidelines for Behavioral Health Crisis Care Summit in Washington. So they give their regrets, but believe me, as SAMHSA is always doing, they're about getting work done. And we are thankful for everything that SAMHSA is doing to forward this progress with 988. So we're now going to move over to our NASPID segment. And it is my pleasure to introduce my colleague, Carrie Slatton-Hodges. And Carrie is going to give the NASBIT update today. She is our Senior Behavioral Health Advisor with NASBIT. Carrie, go right ahead.
Thank you, Brian. And in lieu of that, SAMHSA is not with us today. I'm going to be mentioning them in my comments today. So they're definitely here in spirit and here in conversation. And I wanted to share a wonderful opportunity that several of the national staff had last week. It was to join in on SAMHSA's Supported Employment and CCBHC Policy Academy. It was refreshing to once again put at the forefront of our minds the incredible importance of work in each of our lives. And sometimes we take for granted in the work that we do that the ability to get up and feel like you are making a difference in the lives of others and to set goals and achieve those goals, get immense pleasure and fulfillment from employment. Sometimes we forget about folks who don't have that opportunity as readily available. And so it was a great reminder for everybody to understand the incredible importance of employment and work in recovery. We were joined by Rhode Island, New York, Mississippi, Oklahoma, and Kansas, who all have done tremendous work around supported employment. But really are looking to the future to see as the CBHC develops across the nation, can they not only sustain, but the work that they're doing in supported employment. The CCBHC, with its creative payment model that pays for the cost to support staff to do the work that we're needing, really lends itself to the development and implementation and sustainability of supported employment. And in particular, we focused on IPS, which is individual placement and support. And the beauty of IPS is it's not a cookie cutter model that says everyone must go through these unique steps in order to be employed. It's really about reaching and meeting people where they're at, finding what it will take for them to be able to meaningful work and succeed in that meaningful work. So we had wonderful guest speakers to tell us about not only CCBHC and the opportunities there, but the individual placement and support. So it's really a wonderful meeting. We thank SAMHSA for reminding us of the great importance of employment, in particular in recovery. And also reminding that historically, there was a stigmatizing view that persons who had a severe mental illness or had an addiction issue were better off not going into the workplace, that would maybe be too stressful or cause symptom increases. But what we've learned over time and through research is the opposite is true. That the ability to have meaningful work in your life actually in and of itself can have a reduction in symptomology and aid in recovery. So when you combine treatment with the support of employment, you just have such a winning combination. And we really thank SAMHSA for reminding us all and putting it back in the spotlight, so that we know for everyone to have a link in the community, that supporting them in the goal of employment is incredibly important. So thank you, Ryan.
No, thank you, Carrie. Appreciate that information. And it's always very thorough and very engaging. So thank you so much for that info. Also want to remind folks that with NASBIT and with the Crisis Jam, we've been keeping tabs on topic areas that have come up from various states. And we just want to let you know two things, is that all of the states that you see the names of, we don't quite have input from, but it's a reminder to everyone that you can submit suggestions for any future Crisis Jams. Just place them in the chat box or send them to us through talk.crisisnow.com. to just alert us to things that you might find interesting and would be taken into consideration. As it stands right now, we have about 34 states involved, but the numbers are ever growing. We're looking forward to your input to ensure that everyone has a voice in terms of what types of topics will be coming up. And thank you. You can do it either through that. If you want to drop it in the chat box now, it would be wonderful. And I see folks are already doing that. So thank you so much for the topics, because this is something that we value genuinely. Thank you so much. And let's go to the next slide. And we are now at our data corner. And with that, I want to introduce Matthew Goldman. Or Dr. Goldman is the medical director of the King County Crisis Care Center with the Levi Implementation Planning. So Matt, it's all yours, sir.
Thank you, Dr. Sims. Good to see you, and hello, everyone. So I'm going to share a data corner with you today. This segment of the Crisis Jam we do about once a month, and like to highlight various new findings, research that's happening, different evaluations, studies in the crisis services space. And so today, going to provide some updates on some recent publications and papers that have come out. So we can go to the next slide. So the first thing to announce, which I think this might have been announced at last week's Crisis Jam as well, but want to draw all of your attention to a special issue of a journal called the Psychiatric Clinics for North America, which has focused specifically on crisis services. The journal invited Dr. Margie Balfour and myself to co-edit an issue of this journal. And you can see there are 10 review articles in this edition that range a wide set of topics spanning from crisis system design and accountability to talking about the components of the crisis continuum itself, including call centers, mobile crisis response, stabilization facilities, and also post-crisis follow-up. And then also addressing some clinical best practices in crisis services, including focusing on violence risk assessment, working with people with intellectual and other developmental disabilities, focusing on serving people experiencing homelessness through crisis services, and also serving youth populations. And so this isn't new research, but it is a new set of reviews that summarize the evidence for crisis services in each of these different sort of focus areas. And so I think the link is in the chat to this edition. I will say the issue is firewalled, like you have to have a subscription, but what I encourage you to do is either reach out to me, and my email will be in the chat in a moment, or reach out to the corresponding authors for each of these articles. And anything that looks of interest, it should be easy to send a PDF of the articles that you can access the full text version. Don't worry about the paywall being a barrier to your accessing this information. Next slide. These are just a couple additional updates to highlight that there's a lot of work happening in the research crisis services space. There are 2 papers that just came out this month. One was written by Amanda Mori and colleagues that focuses on crisis services offered by Certified Community Behavioral Health Clinics, or CCBHCs. And we're hoping to have Amanda on an upcoming data corner to highlight that work. Also, my research group just recently published this month a qualitative study of people experiencing homelessness who received a mobile crisis response by a team in San Francisco that was dedicated to serving people experiencing homelessness. And so some really rich qualitative results in that study that I encourage you all to check out. And again, we'll be planning to have Megan McDaniel, the first author there, to come to a future data corner to present on that work. There are also new NIMH, National Institute of Mental Health, research funding opportunities. These are very exciting that NIMH has been successful at dedicating these 2 research opportunities to crisis services and suicide prevention. So you can see that there's an opportunity for R01 clinical trials. Those are large randomized research studies in general, and then R34 clinical trials, which tend to be smaller implementation type studies. And so funding to continue to expand this evidence base is critical, and NIMH is investing in these areas. So encourage you and any research colleagues that you might have to look at these opportunities to study the various programs that you all might be involved in and implementing across the country. And to the next slide. This is my last one for today. Just want to remind you all that the National Survey of Mobile Crisis Teams report is published and is live on SAMHSA's website. This was a survey of about 550 mobile crisis teams across the United States, describing attributes of these teams and helping inform the field moving forward. So that is available for your reading pleasure as well. Just wanted to re-highlight that. And then last but not least, a call to all data people. If you or someone you know wants to present on a future data corner, please get in touch with me or share, papers that you think might be interesting to highlight. My email address is on the screen here, and we'll put it in the chat as well. And yeah, appreciate the chance to highlight some of these latest works that are coming out in the research field on crisis services. Thanks so much.
As always, Matthew, thank you so much for that. I do want to let folks know that, yes, all the data is in the chat box for your referencing already, so please feel free to go through that. And Matthew, thank you so much. We are going to move now to our crisis talk. And it is my pleasure, because I really feel for this person, because from my understanding, it is probably maybe like 2 or 3 in the morning where you are. But it is my pleasure to introduce to you all Sue Mary, who is a guest writer with Crisis Talk and with Practice Zero Suicide with the Institute of Australasia. And Sue, it is such a pleasure, and I thank you. Number one, if you have a cup of coffee, maybe about the size of California, please feel free to sip on it while we're talking, but please go right ahead. And thank you for joining us.
Okay. Thanks so much, Brian. And it's great to be here. Hi, everyone. Look, this week's crisis, hashtag crisis talk, the article has stemmed from one we did earlier in the year. And we looked at innovations from the advent of the Lifeline crisis lines about 60 years ago. And in that article, we talked about the newest sort of innovation on the blocks, and that is around holoportation. So first, I guess I should say, what is holoportation? Well, it's actually a combination of augmented reality and virtual reality, and what we're now terming mixed reality. And what it does is give you a real-time presence with a 3-dimensional capability. So it actually looks like you are in the same place as another person, and yet they could be hundreds, if not thousands of kilometers away. And you can see things like hand gestures, body positioning, the emotions that come into a conversation. So I think it offers a great promise for supporting people who are living in isolated and difficult to reach locations. And as an example, NASA teleported their flight surgeon into the space station in 2021 to check on the health of the astronauts. So it's got lots and lots of potential, I think. There is also potential to look at holoportation in terms of training and supervision, and that could really offer us just one solution towards the many critical factors that are supporting workforces right across the globe at the moment. And it's going to be in the future that we're going to be able to transmit true representations of ourselves into the digital world using holoportation, and will turn up anywhere in the world in real time. So you can see and hear and interact with people as if they were in the same physical location. Think about a psychiatrist being able to provide supervision support to another colleague using this sort of technology, or upskilling our peer workforce to develop safety plans in collaboration with a person experiencing suicidal distress and being able to check on them on occasion. All of that could be feeling as though you are actually in the room with the person. I have to say, Dr. John Brayley, who provided a lot of that original work, really said this is definitely something we need, but it's not a silver bullet. And that idea of technology with face-to-face is still the optimal. It certainly has limitations. We discuss the limitations in the article, but we also talked to a group of users in Montreal, and their response was really positive. Doctors loved it, nurses felt it helped their work, and it made their job easier, and the people they were supporting really found it highly acceptable. So we're not yet into the realms of telepresence, but I think the article's about preparing for the future. There's no reason not to be an early adopter, to look into this type of technology, because it is our mantra that we provide quality mental health care to anyone, anytime, anywhere that it's needed. Thanks, Brian, very much. I hope you get over there and have a little look at the article.
My goodness. No, thank you. We had some discussion before your talk because I just looked at the overview and it was just so fascinating, the concept, because here in the US, there's been a lot of talk about post-COVID and 988 and getting people services. And for most of the areas that couldn't receive services, telemedicine was one of the issues that seemed to come up to the forefront. So just hearing about this particular portion, I saw some comments in the chat box that talked about it to say that it was especially good for people who are reticent to speak over the phone or on the web. I mean, I see it moving in that direction. So this is something I'm really thankful to you to bring out at this juncture. As you said, we realize that it is not a tomorrow item, but I think it is a valuable tool to really look at. Was there anything else that you'd like to add, Sue, at this time? Because again, I don't want to keep you awake too much longer, but if you had anything else that you'd like to share about?
That's very kind of you. No, that's fine. But really encourage everybody to hop over to talk.crisisnow.com and have a look at the full article. Thanks, Brian.
Absolutely. We will definitely do that. Thank you. And now go get some rest. And we look forward to talking to you at another time. And thanks again for everything. As we move to our next slide, we are coming down to the end of today's session. But before we get there, I had a very quick question. And Sarav, if you're still on, if I could ask you to come off of mute.
Absolutely.
Thank you. Thank you. I was thinking of this question, but it popped up also in the chat box. You had mentioned during your talk about your connections with the veterans. And I was wondering if you could give like a quick 30-second or whatever overview of the detailing that a little bit more about what is that connection and how it's been helpful.
Sure. No, thank you. That's a great question. So I will preface that by saying that the collaboration happened several years ago before my time at Trevor. I've been here for 2.5 years now. So from what I know, as the ramp up for 988 was happening, as the advocacy for it was happening in 2017, 18, and 19, I know that the Trevor Project collaborated with the veterans organizations to support LGBTQ youth services for the people that we serve, and the Veterans Crisis Line services for the veterans. I know there was mutual support when we were going to Congress and advocating for that, when we were doing national organizing around that, when the 100 or so organizations that I mentioned came together to push for 988 and for specialized services, there was mutual support. So that's what I know. Right now, I know they're separate services, so we're in a different place now, but it's more like historical.
Okay. Well, thank you again for that, Sarav. And we have the next episodes coming up of the Crisis Jam, CIT in Action, which is going to be a live conference that's going to be teleported into the Crisis Jam for that week. And following that week, we'll also have in the next week, if we go to the next slide, practical uses of AI. So I want to thank everyone who was on board today with us, and everyone have a pleasant rest of your day. And we'll look forward to seeing you next time on the Jam. Bye all.